Hey, how are you guys doing? I'm Megan Cranenberg, Doctor of Physical Therapy, the owner of Chrysalis Physical Therapy in Poulsbo, Washington, as well as Crane's Castle Brewing here in Bremerton, Washington. And I'm joined today by Jake Bartholomy, and I'm going to let him introduce himself in a second. And this is the second installment of the Pints for Pelvic Health podcast, where I just get to sit down and have really awesome chats with very lovely people about the work that we do addressing bowel, bladder, and sexual function within men and women and children and all ages and all genders, right? So I'm going to hey Jake, who are you?
Thanks for having me, first of all,
Absolutely.
Megan, and talking about these important topics. I'm Jake Bartholomy. I'm a physical therapist in Seattle at Flow Rehab. I got my start in pelvic health when I was an outpatient orthopedic physical therapist for 10 years, and I sat next to a pelvic health therapist who said, hey Jake, they finally wrote a men's pelvic health course. She's like, do you have any interest in taking it? And she's like, if you can, that would help get in my male patients sooner and me get my female patients in off my 4-month wait list. She's like, I'm right here to help you. And so I took that first men's health course and began my journey in pelvic health.
Cool.
Yeah.
So how long have you been a physical therapist?
I'll be 19 years now in August. Yeah.
What is your favorite thing about being a PT?
It's a great question because there's several things. I love how broad the field is, and
So much,
yeah.
Right? I had no idea starting PT school, the breadth and the depth of our profession.
Yeah, that was kind of what helped lead me into it because I was afraid that if I got bored in one area, like I could just completely switch gears to go from pediatrics to geriatrics to home health to ergonomics.
Professional ADD.
Yes.
It's a good field for that.
And luckily, just being, I did choose outpatient orthopedics, really thinking I wanted sports medicine aspect of it, and didn't get a job like at a university like I was kind of thinking. And I'm glad I didn't, because I think seeing all athletes would have been too intense or too much. And I like seeing some athletes and then some elderly and some car accidents and some just chronic pain. And so outpatient orthopedics did provide me that nice wide range.
Yeah, it's really fun.
Yeah.
Even if it's the same diagnosis from person to person, the person's always different. And
absolutely.
I think we tend to be a career full or a profession full of people with a heart for teaching and kind of finding the way to make that information click with the next patient on your caseload, which could be totally different than what worked for that previous person.
Absolutely. Individualizing for each person is so important.
What do you think is one of the biggest challenges of our job?
That's a great question. I think getting people in our door, like letting people know that we're here to help certain conditions.
That's why we're here, right?
Right. And then having it be affordable for patients versus via their insurance or denials or partial payment, or I'm actually in a cash practice, which is unique and surprising in our insurance-dominated reimbursement world. We're making it work with a cash practice, which is really, really nice on our end to not have to fight insurance companies.
Yes, I'm very aware of that. I'm primarily insurance-based for those who are just kind of tuning in. So it's two different models of care. You're going to see a lot more cash-based practices crop up, I think, especially for single provider practices or small practices, because the overhead of paying billers and dealing with insurance denials can be really a common part I see in the pelvic health world too. Whether we're talking about men or women or children, I think the gender gap is pretty narrow that way. A huge challenge. I had a gal who was coming to me paying cash out of pocket because her insurance is an insurance, Aetna, that won't contract with me. And I don't mind calling out Aetna on this on this podcast at all, because I think consumers deserve to be aware. And she's coming to me for a condition called vaginismus or dyspareunia, which is either pain with sexual intercourse or the inability to even have vaginal penetration because the muscle guarding is so tight. And I think your boss, Holly, was one of the first people to really talk about how, in a class that I took with her, that is a medical necessity. It is a medical necessity that we can have normally functioning satisfying sexual lives because of the ramifications in mental health, fertility, being able to, undergo necessary medical testing.
Absolutely.
That's important. And so she was working with me for a few sessions, and she sent off the notes to get her out-of-pocket reimbursement, and just got a letter from Aetna that said, we don't pay for physical therapy. We don't pay for services at the patient's convenience. And I think, so I quickly did a medical search, and does Aetna pay for Viagra? Because if they pay for Viagra, they better be paying, and they don't, actually. I didn't find that on a drug list, so.
Interesting.
At least but those are definitely the challenges that we see, and that the kinds of conditions that we treat sometimes are seen as, well, you could just have a glass of wine and relax, and maybe that would be okay.
Yes.
I don't know, on the male pelvic health side, what are some of the analogs to that?
I think it's worse. I think male pelvic health is still underrepresented, underrecognized, and underaddressed. And so it's a huge area where we're trying to educate people and providers that we can help some of these things. The women's health, pelvic health movement has just been leap years ahead of us. I think maybe it started with pre and postpartum, and then just kind of broadened out from there to women who hadn't had a baby and still had pelvic pain, and similar treatments were effective. And for so long, men were just any issues down there were called prostatitis and given antibiotics. And so we've got to really work on educating and do more research to show that it's not just prostatitis, and that physical therapy can help these conditions.
You bring up research. That's a hard one. I was talking with someone yesterday who works as a clinical trial manager, and when I saw that was her job, I was like, oh, such a love-hate relationship with research and physical therapy. And she's like, oh, tell me why. Why is that? Because it's almost impossible to design a high-quality, large population randomized trial, because we could go to the same class and have the same training, and you're going to have one way of explaining it, or your hands work a different way, and the patients coming in your door are going to have a different way of interpreting that and moving their body, and trying to have broad treatment strategies to what are inherently subjective interactions with patients is
absolutely
it's really tough to do. And so we tend to be behind, the field of physical therapy in general is, you're not going to find those high quality trials, so we have to.
Exactly. So when you're trying to educate physicians about what you do, and they're an evidence-based physician, and you can't provide that perfect double-blind study because you just can't do that in our field very well. It has to be, you have to take our professional expertise and subjective input and for studies, and that's why I think largely how physical therapists treat and are effective, but we can't necessarily back it up with research because it's just so hard. You take a study on back pain and and you try to do bridges or clamshells with all these people with back pain, but their source of back pain, each person is different, whether it's a disc to the left or to the right, and what they respond to.
Or just fear.
Yeah.
Fear, some research coming out about just fear of movement impacting our perceptions of pain more than anything going on at the tissue level. So real quick before this session dies, so if we're talking awareness and affordability for those seeking your services, do you have kind of like one or two top tips of how they can look into ways of improving the affordability at a cash-based practice?
Yeah, that's a tough one. Trying to educate people to plan for their own health beyond their insurance. So many people spend a lot more money on their pet care or on their car than they do on their own health. And it's just the paradigm, depending on their age, that insurance will always take care of themselves. And so they're just not in that mindset of paying out of pocket for their own care. Whereas if they break it down and look at what they're spending on health food and organic food and going to the gym, that they really are budgeting for their own health, and they just needed to look at certain forms of care like physical therapy as maybe part of that budget. They need to look into for our clinic, if it's a cash practice, they can still use their out-of-network benefits. And so a lot of people might not realize that, and we try to educate them that. And so they can get reimbursed a certain amount. And then they should be going to their bosses and their HR, every year when they're going for re-enrollment with their insurance companies, and maybe fighting for better out-of-network benefits, or they can choose when they're choosing their plan, planning that type of way. But it's hard.
HSAs have been really nice. Like, that's personally what we have. We have a high deductible HSA plan, and my husband's, he works for Kitsap County, and the county has been great about matching our contribution, and so we end up with a pretty good chunk in that HSA account, and I can just swipe that HSA card if I go to an out-of-network provider.
Yeah.
So there's so much to unpack with this. We could talk about this for an hour straight,
Sure.
right? But I want to wrap this part up, and if you'll join us next week for the next segment, we're going to be talking about some specific conditions that Jake treats within the sphere of male pelvic health, specifically pelvic pain conditions. So join us with that. Let's just have a little toast. What are you drinking, by the way?
I'm drinking green Pilsner in honor of St. Patrick's Day this weekend.
Yeah. Today is not St. Patrick's Day, and by the time this airs, it won't be St. Patrick's Day anymore, but it's almost. It's the Ides of March, right. So it was that or togas, right?
Right. In the spirit.
All right, cheers. We'll see you next time.